May is Stroke Awareness Month, and we are on your side on call, and representatives from Willis-Knighton Stroke Center are on hand to answer your questions from now until 7 o'clock. The number is right there on your screen, 318-861-KTBS, and joining us right now is Willis-Knighton Stroke Coordinator Brittany Anderson. Brittany, thanks for joining us.
Thanks for having us.
Yes, and so this is an important topic for people in our area. So what are those signs and symptoms that we need to look for in a stroke?
So for stroke, we use the acronym BFAST. So it not only describes like what you're looking for, but also what we want you to do. B is for balance. We're looking for someone who may be dizzy or off balance or walking off to one side. E stands for eyes. For eyes, we're looking for either blurry vision, loss of vision, or vision where your eyes won't track side to side and they'll stay off to one side. F stands for face. We're looking for a facial droop, a classic sign of stroke. And then A is for arms. So we're looking for a drift down or one side completely paralyzed. S in BFAST is for speech, and we're looking for slurred speech, altered speech, or not being able to find the right words. And T in BFAST, again, describes what we want you to do, and that's time. And it's time to call 911 and seek treatment. Yeah,
these are all really important things, and things that you can kind of easily tell when you just look at someone. So for that time, that's really, really important. What do you recommend for time?
So we have a very narrow window in stroke to treat someone. It is 4.5 hours from the onset of symptoms till we can give a medication. So we don't need people to go home, take a nap, try to rest it off, try to go to sleep, and then wake up the next morning and their symptoms are worse.
As some people say, time is brain.
Correct.
Right?
Yes, so time is brain and we need you quick.
Okay, awesome. Well, good tips, Brittany. Thank you. And again, those phone lines will be open from now until 7 o'clock. If you have any questions, you can give us a call. That number is 318-861-KTBS. May is Stroke Awareness Month, and we are on your side on call, and representatives from Willis-Knighton Stroke Center are here in studio to answer your questions about stroke from now until 7. The number on your screen, 318-861-KTBS, is the number you can call with your questions. Joining us today is Willis-Knighton Stroke Coordinator Cheryl Adair. Cheryl, thanks for joining us.
Thank you for having us.
Yes, so you are a stroke coordinator, so you handle a lot of kind of the data, as you mentioned.
Yes.
But tell me, what are some of those risk factors people should be worried about with stroke?
So there are two types of risk factors. There's the controllable ones and the not so controllable ones. Of course, the ones that we can control are like our diabetes, our hypertension, our lack of exercise, our food that we eat with our wonderful southern diet. All of those all together can contribute, of course, to the increased risk for having a stroke. Not all of them specifically have to be modified. You can take one at a time. It makes small steps, makes a big difference. For instance, taking your medications to treat your high blood pressures, treating your diabetes correctly, monitoring that diet to the best of your ability. And of course, for the stroke risk factors you can't control, like your age, your history, your family history, all those things are to be monitored, you know, with your physician, and work that exercise in there and watch that diet to the best of your ability.
Yeah, so at what age do you think that if someone hasn't seen their primary care physician, when should they go and get checked out, just in case?
Just as soon as possible. Hopefully they have had a primary physician in the past. If not, just as soon as they can get in and get a check for their heart, for their blood pressure, for their diabetes, for any contributing factor like don't smoke, don't do drugs, alcohol, minor to little amount of that, you know, can all be helpful.
And all of those modifiable typically affect a lot of other things, so it's good idea to do that as soon as possible.
Yes, it is.
For sure. Well, thanks, Cheryl, for joining us. And again, those phone lines will be open from now until 7 o'clock. That number is 318-861-KTBS. May is Stroke Awareness Month, and we are on your side and on call, and representatives from Willis-Knighton Stroke Center are on hand to answer your questions from now until 7 o'clock. The number to call is right there on your screen. That's 318-861-KTBS, and joining us is Willis-Knighton Emergency Department Operations Coordinator Sarah Sutton. Thanks for joining us.
Thank you for having me.
Yes, okay, so having a stroke is a really serious condition, so you have to kind of respond quickly. So what should someone do if they think that they're having a stroke?
If someone thinks they're having a stroke, we want them to call 911 and ideally get to the ER as quick as you can. If you're with someone else, you can have them drive you to the ER, but do not drive yourself.
Okay, and why do you suggest maybe calling 911 instead of maybe driving yourself?
So that medical professionals can be there and go ahead and notify the ER that you're coming, and they can do what they need to do in the meantime.
Right, yeah, because they can do a lot of life-saving treatment
Right.
on the way there, whereas like we were saying earlier, time is brain, so
Right.
that's something that we really need to do fast.
Yes, and
Right?
assess, yes.
Okay, and
Yeah.
so once they are in the ER, or they're presented to the ER, what can someone expect, once they get there?
You will be greeted by a nurse and you'll be assessed by a doctor and ideally get you to the CT as quickly as possible so that we can assess.
Yeah, and then kind of know what to do from there, I
Right.
guess, as far as treatment and all that stuff too. Okay, well, thank you. This is great information. Definitely call 911. If you don't remember anything else, remember, call 911 if you feel like you're having a stroke.
Yes.
Okay. Again, those phone lines will be open from now until 7 o'clock. That number to call is 318-861-KTBS. May is Stroke Awareness Month, and we are on your side and on call, and representatives from Willis Knighton Stroke Center are on hand to answer your questions from now until 7 o'clock. The number to call in is 318-861-KTBS, and joining us is from Willis Knighton is speech therapist Elizabeth Walden. Thanks for joining us.
Hi, thank you.
Yeah, so speech therapy, some people may think, you just work with children, but you actually can help patients that maybe have actually recently had a stroke.
Absolutely, we do. So it's very important as a speech therapist to get in and see the patient right away after they've come to the hospital with a stroke. A lot of patients suddenly can't talk, or when they're talking they don't make any sense.
Yeah.
And so it's very important for speech therapy to get in there, evaluate that, and help them find their best mode of communication. We also do swallowing. It's a
Yeah.
really big part of their hospital intervention. And so after suffering a stroke, a lot of patients will need a diet modification. You may have to go to thicker liquids or a puree
Right.
food rather than regular foods. So strokes really affect every part of the body, and so it's very important for speech to intervene.
Right, and so I know that it's different from patient to patient, but do you kind of have an idea of how long recovery is?
Oh, absolutely. So time is of the essence,
Yeah.
honestly. And so the faster we can get speech and physical therapy and all the therapies involved in a patient's case, the faster the recovery. But we like to say that 6 to 9 months will give them their optimum function.
Right, and that's a realistic expectation for them. Well, thanks, Elizabeth. And again, those phone lines will be open from now until 7 o'clock. That number again is 318-861-KTBS.